Children are very often badly affected if one or both of their parents are abusing drugs. They can grow up to hate their parents, but often deny this. It is very important to teach them to love the person, but hate the behavior. Children feel ashamed because these feelings are unacceptable to society. It is bad to hate your parents no matter what. They then direct this hatred at themselves and others. Children often have fantasies that their addicted parent dies, disappears, or is killed. These fantasies cause horrendous guilt feelings that aggravate their anger, and this then becomes a cycle. What then happens with children is the following. They experience guilt, shame, and blame. Children believe they cause what is going on. They blame themselves. Addicted parents often reinforce negative emotions. Kids sometimes believe that they have power over the drinking or drugging at home. Children often take this into adulthood. This leads them to feel able to control other people's behavior. Children secretly carry the blame. A child's anger and blame then internalizes into shame. It is frightening to know that our children are becoming victims of addiction at an earlier age. The pressure on them has never been worse. There are certain warning signs, however, that as a parent you should look out for with your children. These are as follows. Eyes that are bloodshot or pupils that are smaller or larger than normal. Frequent nosebleeds that could be related to snorting drugs. Changes in appetite or sleep patterns. Sudden weight loss or weight gain. Seizures without a history of epilepsy. Deterioration in personal grooming or physical appearance. Impaired coordination, stumbling around for no known reasons. Injuries, accidents, or bruises that they won't or can't tell you about. They don't know how they got hurt. Unusual smells on breath, body, or clothing. Shakes, tremors, incoherent or slurred speech, impaired or unstable coordination. Other warning signs that parents should look out for are preoccupation with alcohol and drug-related lifestyle in music, clothing, and posters, for example. Demanding more privacy, locking doors, and avoiding eye contact. Sudden change in relationships and friends, favorite hangouts and hobbies. Frequently getting into trouble, for example, arguments and fights, accidents, even illegal activities. Using incense, perfume, or air freshener to hide the smell of smoke or drugs. Using eye drops to mask bloodshot eyes and dilated pupils. An unexplained and confusing change in their personality or attitude. Sudden mood changes, irritability, angry outbursts, or laughing at nothing. Periods of unusual hyperactivity or agitation. Lack of motivation, inability to focus, appear lethargic or spaced out. They appear fearful, withdrawn, anxious, or paranoid for no apparent reason. They stop partaking in family activities, family outings, going to church, for example. Their school performance slowly deteriorates. Now, are you asking the following questions? Is your child's behavior driving you insane? Do you harbor insane thoughts about your child? Do you think you're perhaps to blame for your child's behavior? Do you want to do something about this? Are you prepared to ask for help? Do you think the Coming Clean program could help you in confronting these issues?